Welcome back, Jon Barron.
We could talk about teeth for a bit. Tooth decay is actually very common, and it affects virtually every person to one degree or another. It's primarily caused by bacteria that are present in your mouth. You've got bacteria in your mouth of all different kinds. Mm-hmm. Some actually are beneficial. They start digesting food along with the amylase, the enzyme for breaking down carbohydrates in your mouth, in your saliva. Mm-hmm. They'll start breaking down food before you even swallow it as you're chewing it. But some of the bacteria, when combined with particles of food, with saliva, and with acids in your mouth that particularly come from some foods, will turn into plaque, which adheres to the teeth. Some foods are more likely to promote tooth decay symptoms than others. All carbohydrates can play a role in promoting tooth decay because they break down sugars and starches. And it's primarily sugars and starches that literally feed the bacteria that promote the formation of plaque. And particularly sugary, sticky things, such as caramels and things like that, are some of the worst offenders because they actually stick onto the teeth and remain there. They're resistant to washing away with saliva or a sip of water. So they actually stay on your teeth. They tend to be very high acid. And they start working away at the enamel and drawing the bacteria, which then go right in where the enamel has been weakened. Another problem is that sugary drinks like juices and sodas and so on have a couple of problems too. One is they would tend to normally wash over your teeth, you would think, and be gone fairly quickly, except you tend not to drink these things. You know, like you're drinking water when you're thirsty, you tend to sip them. So effectively, you're continually bathing your teeth with these sugary drinks for a period of time. And if you're having 4 or 5 of these drinks a day, then you're literally bathing your teeth in these sugars for hours every day. And that's a problem. And also, some of them, the high acid ones, literally are acid, are either acidic or acid forming. And things like orange juice, for example, they can literally start breaking down the enamel. The acid can start breaking down the enamel in your teeth in as little as 30 minutes. When you linger with a drink that contains sugar, and particularly one that's high acid, and some beverages actually, again, like juices and even teas, energy drinks are actually worse than sodas other than colas. Colas tend to have a very high phosphoric acid content, but other than most sodas, juices tend to be more acidic. They resist buffering from the saliva. They maintain the acid environment in your mouth long after you stop drinking. And the high acidity, as I said, wears away the enamel, which is a protection for your teeth. The enamel is the coating that protects them from the bacteria. So you wear that away, they become much more vulnerable to tooth decay. It's also one of the problems, and we talked about this, when you have a root canal. What the dentists tend to do is they try and pack the inside of the tooth with something like gutta percha to seal it off when they're killing the nerves so nothing can get in there. But the fact is each tooth has miles. I mean, every tooth has literally miles of tiny tubules in it. And the gutta percha can't go in there. So bacteria can live in there and can breed inside those tubules, and they can leach out toxins. And that's the other thing, the bacteria in your mouth, every bacteria, they create toxins. They're waste products. Those toxins are absorbed through your gums. Those toxins make it way to you swallow them and are absorbed through the intestinal tract. In a root canal, they're actually absorbed directly into the bloodstream through the blood network and the gums. So these are all different ways that you can take bacteria and the toxins they produce into your body. And it's the toxins, the bacterial toxins, that ultimately are causing the problem. According to dentists, if you do gentle, thorough brushing of your teeth, that should do a good job of eliminating a lot of the residue that's left behind from the drinks. And they normally recommend twice a day, morning and night routine for brushing. And that's a good thing, but that's sort of really just a start. First of all, let me mention that the morning toothbrushing ideally should take place after breakfast. Most people get up, brush their teeth when they wake up, and then they go and start their day. Will then go, have breakfast, head off to work, have lunch, have dinner, and then brush their teeth before bed at night. And that's certainly not a bad thing. But ideally, you would like to brush your teeth immediately after breakfast If you can bring a toothbrush with you, do a quick brushing after lunch and do one after dinner. And you would want to floss at the same time to get the particles out from between your teeth. But there's something else you can do. In the morning, you might want to do oil pulling. Oil pulling is actually an ancient Ayurvedic technique that was sort of rediscovered by an Indian doctor and has become very popular. It's billed as a method of detoxing. You basically take an oil like sesame oil or sunflower oil, or people are now using coconut oil, but you put it in your teeth and you swish it around for about 20 minutes. And it was billed as a way to detox. The idea was attracting toxins from your body into the oil, and then you'd spit that out when you were done, and you were removing toxins. And I think what's happening, and there are studies that actually support this, is that really what it's doing is most oils are both antibacterial and anti-inflammatory. When you swish them around in your mouth a long time, such as a sesame oil, oil does what oil does. It's very oily. It seeps into all the nooks and crannies, like a butter melting on an English muffin. It seeps between your teeth, seeps down behind the gums. It seeps everywhere. It does what toothpaste cannot do. It does even what a mouthwash cannot do. Because again, being oily, it tends to seep. Mouthwashes will just bathe. So they tend not to go behind the gums as well as an oil will do. So it seeps behind there. It kills the bacteria and it kills the inflammation in the teeth from right next, where the gums are right next to the teeth, in a place that nothing else can reach. One of the problems, we talked about this earlier, we'll go back to it, when you have a root canal, what the dentists tend to do is they try and pack the inside of the tooth. It's one of the reasons people claim that things like oil pulling are beneficial not only for your gums, but they help with arthritis, they help with chronic illness, they help with chronic fatigue. Oil pulling does all of this. Why? Because it's getting rid of the bacteria and the toxins that contribute to it. I don't think it's actually doing any detoxing, but it doesn't mean it's not incredibly valuable. It's just I think the explanation has been wrong. So it's killing the bacteria and it's stopping the production of those toxins that are absorbed into the body. So oil pulling is very useful to do before you even brush your teeth. It also tends to wash away any plaque on the teeth. It's great for that. It actually will whiten your teeth over time. And then the other thing is when you're finished with oil pulling, you need to brush your teeth because you spit the oil out and it's absorbed the toxins, so you want to get rid of that. And you want to scrape your tongue. Tongue scraping is another great thing to do for dental health. You'll be surprised when you do it in the morning, the stuff that comes off your tongue. I mean, it's sort of hard to describe. It's thick, it's pasty, it's a combination of saliva and bacteria. It's the stuff that's going to be forming plaque, and it's loaded with live bacteria and toxins. So you scrape that off. That protects your teeth. So even if you're not doing oil pulling, doing that regularly is a good thing. You do it after oil pulling, and it's really disgusting what you end up pulling out on that scraper. So that's another good thing you can do for your teeth. The other thing you can do, there are a couple of supplements you can take that are invaluable for teeth. And those are essentially proteolytic enzymes and anything that contains an avocado, soy unsaponifiables. These are sort of natural soapy substances that are found in avocado oils, and that's what they're called, and in soy, and they're called avocado, soy unsaponifiables. And they can be incredibly valuable for the teeth, which would be invaluable. Proteolytic enzymes literally dissolve. They make their way, you eat them, they make their way from the digestive system, and yes, they do pass through we've had people say, well, enzymes can't pass through the digestive wall. They do. They make their way into the bloodstream and then from there into your saliva. And literally, in about a week, can clean up most plaque, start dissolving the calculus. So proteolytic enzymes are invaluable for maintaining dental health and periodontal health. Bottom line is taking care of your teeth. It's essential to think prophylactically.